So we would like to start with a land acknowledgement. In the spirit of reconciliation, we acknowledge that Manitoba is on the traditional lands of the Cree, Ojibwe, Oji-Cree, Dakota, and Dene people, and the homeland of the Métis Nation, and we are in Treaty 1 territory. So it is my pleasure to introduce our speaker for today, Harry. Harry is an occupational therapist specializing in fall prevention, home safety, and supporting older adults to remain safe and independent in their communities. He also works in home care, providing safe client handling training to staff, and holds certifications in senior home safety, adaptive home modifications, and facilitating older adult learning. Please join me in welcoming Harry.
Right. Thank you very much for the warm welcome. Good evening, everyone. It's my pleasure to be here. This evening's presentation, I'm going to be speaking about falls prevention and A&O safety aid program, which is geared towards specifically fall prevention. So during this session, we're going to be looking at practical ways caregivers can reduce fall risk and support safe independence at home. We'll review some common warning signs, simple environmental changes, and how structured exercise programs like the SafetyAid program can help older adults maintain strength, confidence, and mobility. So with the presentation here, the objectives are going to be, we're going to talk about what the definition of a fall is. We'll talk about understanding the impact that falls have on individuals, families, and communities at a large. We'll review what falls risk factors exist, and then we'll look at identifying fall prevention evidence that was used to create our program here at A&O. And then I'll go over the entire program, SafetyAid, and then provide some information if anyone is interested on how to reach out to us and get additional information or join our waitlist there. And then part of this will be also just taking a look at some of our past programs that we're currently in or we have completed there. So we'll start off by talking about what is a fall. I like to discuss this first because for the majority of people, we all seem to have a general understanding about what a fall is, but it can be important or it can be easy to forget about what the actual definition or what we're looking for a fall is. So it can be underreported in that sense. So when we're talking about a fall, we're referring to something that is unintentional or where someone unintentionally comes to rest on the ground, floor, or other lower level with or without injury. So a couple important things about this definition is unintentionally. So an individual has to unintentionally come to rest. And then when we talk about that resting piece, it doesn't necessarily mean it has to be the ground or floor. It could be another lower level. So for example, if someone is standing and they fall on a chair, that is still considered a fall. The other important piece with this definition is the injury portion, so with or without injury. Oftentimes, we may think that just because an injury didn't occur or there's no bruises, scrapes, or anything like that, that's not necessarily a fall. However, based on our definition, it would be considered a fall. And it's important to report falls so we could get to the underlying issues about what caused that fall to prevent further falls from occurring and avoid any injuries from happening as well. So that's the definition that we use at A&O for our falls prevention program. And the other thing to keep in mind here is falls can happen anywhere, anytime, and they can have many causes. So we like to take a multidisciplinary approach to assess for the falls risk factors, which we'll talk about to help determine recommendations to prevent falls from happening. But one of the other key pieces here is falls are preventable. So it doesn't just necessarily mean that as we get older, we could expect to fall. That's not the case there. So falls are preventable, and we'll talk about what we can do to help prevent them from happening. So we'll begin by speaking to a little bit about the impact of falls on older adults. So like I mentioned here, falls can impact the individual, the family, and the community. And individuals who fall once are twice as likely to fall again. And this impact that we're talking about can include focusing on the mental health. So the negative mental health issues such as the fear of falling. So we may want to avoid an area that caused us to have a fall or where the fall occurred, then making us more deconditioned and increasing the risk of having a fall there. So the mental health portion is something that we want to consider as well. And then there's often a decline in physical health from a fall. We have increased risk of early death. We have difficulties in everyday functioning and an overall decreased quality of life here too. So this impacts the individual on both a mental and physical aspect and emotional, and then family for the caregiving, the increased supports, the time away, all of that, and then the community as large too, especially if the injuries occur and there's hospitalization involved. So not only is it just one area that's impacted, it's an overall picture that we're looking to prevent falls from happening here. Now, when we're talking about fall risk factors, there are a number of risk factors that are known, 250 to be exact. So we like to classify these risk factors in four different categories. So we have the biological or intrinsic factors, behavioral, and then social and economic, and finally environmental. So when we're talking or referring to biological risk factors, we're talking about mobility impairment. So someone could have a balance deficit, a gait deficit, or some muscle weakness, making it harder for them to walk or move around in their home or in and around their neighborhood. As we get older, it does increase the risk of having a fall, but again, it doesn't mean that a fall will occur. Gender plays a role, and then other chronic illnesses and disabilities as well. So, for example, if someone has a cognitive impairment, depression, Parkinson's disease, etc., those are all things that can increase the risk of having a fall here as well. When it comes to behavioral risk factors, we're looking at the history of falls. So, as mentioned earlier, if someone does have a fall once, they are more likely to have a fall again. So the number of falls can impact the risk factors here as well. Fear of falling may make us be a little bit more wary to be mindful of our environment, can cause us to have an increase in the risk of having a fall again. The number and type of medications that an individual is taking, typically three or more, is linked to an increase in fall risk, or type of medication such as antipsychotics, sedatives, or antidepressants as well. And then the use of alcohol can impact us having a fall as well, or risk-taking behaviors or lack of exercise. I will elaborate a little bit more on some of these risk factors as we go throughout and kind of how our program is tailored towards it. This is just meant to be an overview here. So when we're talking about the social economic, we're looking at lack of support networks and social interaction. If someone is living alone, a lack of transportation, language barriers, race, culture, ethnicity, low income, poor living conditions, etc., that can all impact access to health services here as well. In terms of the environmental, we look at home hazards. So in the commercial or residential fields, inadequate building codes that don't allow us to have accessibility issues there. We have obstacles or tripping hazards that can get in the way and increase the risk of having a fall. When we look at outdoor hazards, we're trying to look for curbs and ramps. Are they present where they should be? Do we have a lack of rest areas, or do we have sufficient place to kind of stop, sit down, and get a rest as we can continue walking so we don't get fatigued and tired? And then we're looking at slippery or uneven surfaces, especially here in the winter time or the fall. And then in public buildings, we're looking at that design and maintenance too. Do we have adequate lighting? Is the snow shoveled and removed? Do we have access to those areas that we need to safely navigate throughout? So these are just some of the risk factors that we look at when we're assessing our clients in our program and then finding recommendations or ways to keep people safe. Now, there are a number of different steps that can be taken to prevent falls. This slide just refers to several evidence-based approaches. So, for example, improving one's balance and strength can help prevent falls. Staying active and exercising daily is also another great way to prevent falls. Managing your medication or reviewing medication on an annual basis with a doctor or pharmacist is another great way. Looking at the nutritional aspects such as vitamin D levels, calcium, protein, fluid, and healthy eating is something that we consider here as well. Managing health conditions. So, a number of health conditions can impact or increase the risk of having a fall as well. Another key piece here is taking care of your eyesight. So, recommend, going to see a optometrist on a yearly or yearly basis there just to get your eyes checked so that we're not going to be falling over hazards. We have enough ability to see what we're looking at there. And then we'd like to talk about foot care and safe footwear as well. improper, unsafe footwear can increase the risk of having a fall, especially here with our climate in the winter with the snow and ice as well. We like to also look at identifying, removing, and reporting hazards, which I'm going to discuss in a little, or in a few slides here. What are some common causes for those hazards, and what can we do to eliminate or at least mitigate those risks? And then fear of falling as well, like we touched upon briefly, so that psychological piece as well. So when we created our SafetyAid program, those are all the different risk factors and things that we looked at for a falls prevention perspective. And SafetyAid is an evidence-informed community fall prevention program for older adults age 65 or older who live in Winnipeg, Manitoba. Now, if you are right around 65 or you just have general interest in this program, you could always feel free to reach out to us, and then we could always contact you back and figure something out there. But that's kind of been our guidelines for that. And then the SafetyAid program itself consists of four different components. So we start off by what we call a fall clinic, which is a fall risk assessment. And I'm going to elaborate more on that. But we've got a number of different healthcare providers who meet with each individual participant, assess them based on those risk factors, and provide recommendations. And then once eligibility is confirmed, we have our exercise classes. Our exercise classes are about 6 months long. They're offered 2 times a week for 1 hour. They are virtual, and that's really geared towards looking at the balance and the strength training for improving or reducing our falls risk. During our program, we also offer educational sessions which elaborate on a number of different things to reiterate the importance of falls prevention and some strategies that we could do to prevent falls from happening in our home. And then finally, during our program, we offer a home assessment where I come out and I assess the environment, both inside and outside, help answer questions, make recommendations on the environment and equipment that might be suitable for someone. So that's just a very quick overview of the program. Now, in terms of eligibility for the SafetyAid program, this is what we're looking for. Age of 65 years and older, living in Winnipeg, Manitoba. And this is important because part of it is us coming into a client's home and doing a assessment of them. So we do need to physically see individuals, which is why we have residing in Winnipeg. And then we do require the ability to follow directions as our exercise program is virtual, and one of our athletic therapists is facilitating the classes there. So you do want to be able to follow along to not only from a safety perspective, but to gain the benefit from those exercises as well. And then medically clear or able to participate in exercises. And because they're an hour, we are looking for that 1 hour length. So we do consult with medical teams or individuals, family doctors as we need to, as we're assessing the eligibility here for our program. Now, what does our intake or screening process looks like? We ask that anyone who is interested can make a self-referral. A family can refer a healthcare provider, such as a physio, athletic therapist, doctor. They can also refer to our program as well. We have two different ways to do so. The first is through phoning our intake line, which is 204-956-6440, or sending us an email at intake@aosupportservices.ca. We'll provide this information in a document afterwards as well, so everyone has it. And then our screening consists of confirming the eligibility, but we also want to make sure that we're looking for any barriers to participation. So, for example, we provide the exercise equipment that is going to be used throughout the 6 months of the program. So this includes ankle weights, dumbbells, etc., anything that's required for that. And then if someone, requires a tablet to log into the programs, that's also provided. The tablet comes with internet access as well. So one key thing about our program is we're trying to help overcome barriers so that individuals can participate to prevent falls from happening. And then once all of that is taken place, we register individuals towards the fall clinic here. And each program, we're taking in about 8 participants per session there. Now, what does our fall risk assessment actually look like? So we have a number of different healthcare providers, 5 to be exact. So during this assessment piece, each participant will meet with a nurse, a dietitian, a pharmacist, our athletic therapist, and then myself, the occupational therapist. Now, we do break it up into two different parts. So we have a in-person assessment piece and we have the virtual assessment piece. During this time, we provide what we call a pre-clinic package. There's a lot of information with the healthcare providers. So this package is just meant to give people kind of a heads up as to what to expect, allows them to write down any questions they may have, or keep all their information together when they're going to be meeting with the healthcare providers. They are usually completed on separate days, appointment based, and then they last anywhere between 30 to 45 minutes. So you have a great opportunity to meet one-on-one with our healthcare providers, get their recommendations, and ask questions as needed as well. So what does the physical assessment look like? So what usually happens is an athletic therapist and myself will come in to a client's home and we take a look at the person's baseline. So we do what's called a brief bestis, and this is just a series of assessments that help us determine what's the best approach to tailoring that exercise program to each individual person. So we have some individuals who do exercises seated, some are standing, some move along throughout that spectrum throughout the program. So this just allows our athletic therapist to determine what's the most appropriate way to support individuals in this program. Other things that we look at are, can individuals get up from the floor, again, to help us figure out a baseline. We also take a look at an individual's blood pressure and their foot sensation. Those last two assessments go towards our nurse afterwards, and then they discuss them when they meet with each participant there. Other things that typically happen during this physical assessment piece is just reviewing and talking about what other physical activity each individual is involved in. Again, just to get an understanding of where they're currently at. And then this helps us at the end to determine if this program is going to be a good fit, as it is 6 months long, and how and where we can tailor the program there. Now, in terms of the whole environmental assessment, what we do here is we provide a home safety checklist. We assess footwear and any sort of assistive devices like canes, walkers that someone's going to be using, if that's going to be something that's going to be part of the exercise program. We provide education on a tablet use if this is required. We also take a look to make sure that there is a safe place for each individual to participate in their home, and then we will schedule in a home assessment for a later date. So this initial portion is just getting the baseline information, ensuring eligibility, and making sure that there's a safe space available for everyone. Then we jump into our virtual assessments, and with our nurse, what they do is they're reviewing demographic information, falls history, health history, so asking about osteoporosis, urinary incontinence, cardiovascular disease, cognition, visual impairment, and mental health. They'll review the foot sensation, the blood pressure results, and see if there's any community supports for recommendations that they can make at this point in time as well. Our registered dietitian, what they're looking to assess is reviewing the 24-hour food recall log that's provided in our pre-clinic package. And they'll just be able to help guide kind of what someone is typically eating or drinking throughout the day. They're able to review Canada's food guide and those recommendations. And like I mentioned, vitamin D, calcium, protein, and fluid intake as well, and discuss any other dietary concerns as well. This is all based on the evidence that's known about what increases the risk for having a fall in community dwelling older adults. And then finally, our pharmacist. This is a virtual medication review. So our pharmacist will touch base and assess for current prescriptions or any medications an individual is taking, whether it be over the counter or prescribed. Take a look at any herbal supplements, and then talking about, are the meds taken as directed? Are there any potential side effects that may increase the risk of having a fall, or if there's any side effects with alcohol use, if that's applicable as well. So it's a thorough medication review, which helps us to highlight if there's any sort of risk for having a fall for an individual. Now, at the end of that fall clinic, each client will then have completed an assessment with all 5 healthcare providers. We provide a list of recommendations and strategies right away to be able to help prevent falls from happening right then and there. And then we determine the eligibility for the exercise program and schedule a home assessment if this is going to be a suitable fit here. Now, a little bit more information on the exercise program. As I mentioned, it is 6 months in length, offered twice a week for about 60 minutes per session, again, virtually. And the goal here is that we're including challenging balance and strength exercises. And those balance tests that we've done during our initial home visit, they get completed both before and after, which helps us to understand the baseline and then all the progress that gets made afterwards as well. So there are two pieces of that as well. And then afterwards, we have a home visit where we just again complete those exercises as well. Now, in terms of the evidence for exercise, why did we develop the program the way we did it, and why are we using the exercises that we do? Best practice states that in order for fall prevention to be effective, the exercises for balance need to be challenging and progressive. So that's how we've kind of tailored it. And it should be offered at least 2 to 3 times a week and provided on an ongoing basis to reduce fall. So we're looking for a minimum of 50 hours over 6 months to really target fall prevention. So that's just a little bit background about our exercise program. Now, what do our actual classes consist of? So this is just a quick overview there. We have a warm-up session. We jump into some aerobic exercises to help target the cardiovascular conditioning. We have evidence-informed balance exercises, evidence-informed strength exercises, and then joint mobility, stretching, and falls prevention education. So all of our exercises are tailored to really reduce the risk of having a fall. Now, the education session, this portion is delivered in conjunction with the exercise program. So it's typically about 15 to 20 minutes after an exercise session occurs, where it's similar to this, a presentation is offered, and then we have a Q&A. On the next slide here, I'll discuss kind of the different topics that we have. So we do bring in some presenters, like our registered dietitian. We've had optometrists come in, nurses, and etc. to speak to some of these topics. So we have preventing falls and reducing fall injuries as an overview. We talk about exercise and staying active, including the movement guidelines. We have again a topic on medication, urinary incontinence, footwear, vision, nutrition. We talk about sleep. I have a two-part presentation for falls and hazards in the home environment and the safety equipment associated with that. And then we also have how to get up from a fall in a safe manner. And then we do offer a COVID-19 or mental health presentation, which kind of includes the fear of falling to really touch base on the mental health or psychosocial aspect of falls. Now, for the home assessment, which is our last piece, we come in and we assess the home to determine if there's any risks or hazards in the home that are going to increase the likelihood of having a slip, trip, or fall. So our goal is to eliminate those home hazards or at least mitigate them by reducing the fall's risk. So here we're identifying potential areas where fall risk may be evident. Where does an individual spend majority of their time? Is it in the bathroom, bedroom, living room, kitchen? So we assess all of those areas. And some of the hazards that we often find will be rugs, especially if they're non-slip. We have cables or cords in the hallways. If lighting isn't adequate throughout as well, we assess stairs, for example, etc. Oftentimes, we spend a lot of time in the bathroom. So talking about grab bars for accessibility, bath seats, bath benches, lighting, as I mentioned, non-slip bath mats, all of those things that can help prevent the risk of having a fall in the home. And then at the end of our program, what we're looking for is helping to reduce the fall risk and number of falls. We want individuals to be healthier, stronger, and more aware of falls and fall-related risks, and continue to incorporate exercises in their daily routine, even after the program is done too, which is why we offer that the equipment for the program as well, with the overall goal of improving the quality of life. And preventing a fall is one of the most important things you can do to stay independent as someone gets older there. Now, this is just briefly a quick list of the current programs we've had. We are currently on our 8th program, so we've completed 7, with the 8th one coming to a close in a few months here. But typically, a program lasts about about 8 to 10 months, just because the exercise program is 6 months in itself, and then we have the screening and the assessments that happen beforehand. So we've had a number of successful programs over the years as SafetyAid was launched right in 2020 during COVID. Now, once again, I'll just mention how to contact us. So we have our intake line at 204-956-6440, or our email, which is intake@aosupportservices.ca. And if you're a current client with A&O, social work can make an internal referral as well. And that kind of does it for our presentation, but I'll just really reiterate a couple of key points here as well. So there are lots of early signs that as caregivers you can monitor for falls prevention as well. So for example, if someone is walking a little bit slower, that may indicate reduced strength. If someone is using furniture to walk, that could be a balance decline. Reduced activity could be deconditioning. Fear of falling statements could be behavioral restriction. So these are just some things as caregivers to look out for, which may indicate that, even joining something like SafetyAid can help improve balance and strength and confidence for individuals as well. And then some practical prevention strategies for the environment perspective is going to be removing trip hazards like those non-slip bath mats or any area rugs potentially that are slippery, improving lighting around home, wearing supportive footwear, assessing that bathroom as well. And then activity is encouraging individuals for daily movement, avoiding prolonged sitting, supporting participation in these structured exercise classes, and then just watching for medication changes, monitoring dizziness, or noticing any mobility changes early, and then reporting these changes to caregivers and asking for early referrals. So there are lots of ways that we could help support clients or individuals in the community, and SafetyAid is just one example of if anyone is interested on how to improve balance and strength and prevent falls from happening in the home. I will make a quick note as well. If someone is interested in the home assessment only portion, that is something that we offer as well. But at this point in time, I will leave it open for any questions that anyone may have.
Thank you so much for the great information, Harry.